Dr. Leigh Nadler, colorectal surgeon at St. Clair Hospital. If you're watching this video, you're scheduled for a colon operation. I know there's a lot of information that we've given you in the office, and that's why I put this video together for you to review, to discuss it again. It's going to also be on YouTube, so you could see it over and over if you need to. In the office, we would have given you this packet from St. Clair Hospital, which has a number of different papers in it. One is a patient guide, another is patient health information that we ask you to fill out. The hospital would like you to send it back to them. Regarding the surgical prep, you're going to be on a liquid diet the day before surgery. Now, you might also have a colonoscopy the day before surgery. So if that's the case, then your bowel prep will be the day before that. So if your surgery is scheduled on a Wednesday, you might come in on Tuesday for colonoscopy, and therefore Monday is the day of the bowel prep. So you'll be on clear liquids that day. Juice, broth, jello, anything clear that you can see through. We ask you not to drink anything that's red, orange, or purple, because as it passes, you might think you're bleeding. We also ask you not to eat anything that has nuts, corn, seeds for at least 3 to 5 days before the prep, so that the prep works better and your colon is free of any seeds, because those can sometimes clog the scope. The day before surgery, you're going to take antibiotics. In general, you're going to take them at 1 p.m., 2 p.m., and 11 p.m. at night. There is a sheet here that we're going to give you that gives you some different times. It tells you to eat some jello or drink juice before you take each antibiotic. But essentially, you're going to get 6 of 2 different pills. One is neomycin, one is erythromycin. You're going to take 2 pills of each at 1 o'clock, 2 o'clock, and at night at 11 o'clock. Now, if they make you very nauseated or you throw up, I don't want you to force yourself to take the pills. Just stop taking the pills. The idea of these oral antibiotics is to help decrease wound infections. You'll also get intravenous antibiotics that helps with infection, but I don't want you to make yourself dehydrated or throw up before the surgery. The night before surgery, you're going to use these chlorhexidine wipes. We would have given you 2 packages of these, and there are instructions that tell you how to use them. You're basically going to wipe your body down from your neck to your upper thighs, not your face, not the groin. You're going to do that the night before surgery with 1 packet, and with the second packet, you're going to do that again in the morning. We're also going to give you 10 of these little boxes here called Ensure Surgery. This is immunonutrition, which seems to help. In some literature indicates it decreases infection, improves your progress after surgery. So you're going to start this 5 days before surgery. You'll drink one of these little boxes twice a day, and so we're going to give you 10 boxes to take home from our office. You'll also continue this after the operation for 5 more days. So if you go home in 2 days or 3 days, we'll give you enough from the hospital to finish it up. Certain medications can cause bleeding, like Plavix, Coumadin, Xarelto. In the office, we would have told you when to stop those medications. If you have any questions, certainly call us. One other thing is, after your colonoscopy, the day before the surgery, as soon as you get home, that's when you start taking the antibiotics. So it doesn't have to be exactly at 1 o'clock. You might have a colonoscopy at 1 o'clock and get home at 3 or 4 o'clock. That's when you can start taking the antibiotics, and then repeat it in an hour, and then at night at 11 o'clock. When you come into the hospital, you'll come to admissions. They'll bring you over to the surgery department, the surgical outpatient area, and that is where the nurses are going to give you some medications. We'll give you a little heparin shot. There's a number of medications that we give you that helps your progress and decreases infection, and we would have discussed this with you before the surgery also in the office. If you have any questions about this prep, call us. Make sure the prep is either Suprep or Clenpick or New Lightly. That you'll start the day before surgery, usually at about 3 o'clock. If it's a small volume prep such as Suprep or Clenpick, then you're going to take the prep at 3 o'clock and 9 o'clock the day before surgery. If your operation is in the afternoon, we might have you take the first prep at 7 p.m. the night before surgery, and the next dose would be at 6 a.m. the day of the operation. Those times may change if you're going to have a colonoscopy before surgery. We will give you all that information at our office. If you have any questions about this at all, just call us, 412-572-6192, and we will happily answer your questions. Thank you.